and welcome to Breaking News. Today from the south of New York. We are here in New Jersey, central New Jersey. It is the New York metropolitan area and we are in a little town called Watchung. Here we are in the clinic for acupuncture of Dr. Andy Rosenfarb. Good morning, Dr. Andy.
Good morning,
Rosenfarb.
Ernesto.
How are you?
Very well.
Good to see you.
Good to see you as well.
My name is Ernesto. I'm the export manager of RJ Laser Germany. And I have the pleasure to have a little interview now with Andy about a very exciting topic, because among different indications, especially in acupuncture, laser acupuncture, Dr. Andy Rosenfarb, who is doctor for naturopathic medicine and licensed acupuncturist, he has himself specialized in ophthalmology. And here we have several indications which are by school medicine untreatable. Is that true?
Correct.
And here is the deal. Dr. Andy Rosenfarb will talk about how he can achieve extremely exciting, helpful results the world hasn't seen before, correct?
Correct.
And we are talking here about especially using laser for laser acupuncture and treating indications Dr. Andy Rosenfarb will define in a couple of minutes. Not to forget, this is really very, very important, and for many, let's say millions of patients worldwide who should know what we are doing here. And now, Dr. Andy Rosenfarb, please give us some impressions and some ideas about what you are doing in this field of laser acupuncture in ophthalmology.
Thank you. Yeah, well, thanks again for inviting me. And what we've been doing is, over the past 15 years, we've been really focusing my practice on helping patients with chronic degenerative eye conditions, conditions like retinitis pigmentosa, which is a genetic condition of night blindness and tunnel vision that progresses over time, and eventually a lot of cases go blind completely. Other cases like macular degeneration, glaucoma, optic neuropathy, diabetic retinopathy. A lot of these conditions there's no real treatment for, although conventional medicine can use things like injections or sometimes nutritional therapy to help. There's no real solid medical treatment for these. So we've been using acupuncture over the last 15 years and getting really, really good results clinically. We're doing testing of vision before, then we do some acupuncture, then we test afterwards. So it's not really like patients saying, oh, you know, I think I see better, I see better. We're actually testing patients. We're doing visual field testing, visual acuity testing. We're checking eye pressure. We're checking color vision, contrast sensitivity, among other things, which are all showing measurable improvement based on our results. More recently, we found that using laser acupuncture, low-level laser, on certain acupuncture points will get just as effective results as in needles, in some cases, if not better. So we're starting to play around and investigate different frequencies, different wavelengths, different powers of how long we need to do exposure on certain acupuncture points with the light needles in order to help, you know, these types of results, get these types of results.
Very good. And I heard also about a study, a research study for evidence, what we were talking yesterday about in a small chat. And can you define this? I think this is something what may lead us also to our come together today and this interview, to underline what you're looking for, and of course what has to be still approved on a written paper, so to say, artist. So what is your plan? What you want to do now?
So what we have going right now is Johns Hopkins University down in Maryland in the United States. They've taken my protocol, one of my acupuncture protocols for a condition called retinitis pigmentosa. Again, that's a genetic night blindness condition. And we've gotten such good results over the years that we're actually now doing real investigation, research, collaborating with them. We're progressing through the study, and without giving all the results, it'll eventually be published. But what we're finding is there's a definite improvement. Most patients are showing improved vision, reporting subjective. We're finding both subjective and objective positive results. Things like dark field contrast, where people go from outside to inside. That's a problem that people with retinitis pigmentosa, for example, have. That seems to be improving. Things like visual field seems to be improving. Just day-to-day tasks seem to be improving. So these studies are really encouraging. So it's not only that our patients are saying they improve, but now we're really finding evidence-based medical scientific evidence to prove the efficacy of these types of treatments. So that's what we have going on. And the initial study we're doing right now is a small study. It's about 12 to 15 patients. It's a pilot study being done down in Maryland. So the results of the initial pilot are very exciting.
So what does the international literature say? Is there another Andy Rosenfarb, so to say, if you allow, who is doing the same? Who's treating the same way like you, with the same results, somewhere in the world?
Well, what I did for this particular study, I trained an acupuncturist down at Johns Hopkins, so we've already shown that because he can get results, it's not necessarily me. I don't have any special gifts. I just have knowledge or intellectual property that we've been able to replicate in this other acupuncture, is getting the same results that I was getting. So it's really not me. It's just about what we're doing. As far as other acupuncturists in the world, I've trained somebody in Australia. I've trained a person in Israel as well. There are a few other acupuncturists. Not many of them are using the laser acupuncture yet, but most of them are using the traditional acupuncture points with the needle acupuncture. Getting great results, but we're looking towards moving more into at least the integration, if not completely moving over for some of these conditions to laser, using low-level laser. Also,
as you mentioned yesterday to me, that there are many kids, many children, many young children, correct?
Correct.
So when you would look in relation to adults, how many percent are children coming to your office, coming to your clinic?
I'd say a smaller percent at this point are children. Again, doctors are telling parents that there's no condition, there's nothing they can do. The information that we're doing and what we are doing in clinic to help people hasn't really gotten out there yet. We're working on that. That's why we're doing research. I wrote 2 books. We're doing things like this to really just get the information out so people can make an educated decision if this is something they want to pursue. But certainly for using the lasers, it's a lot better than needles for little kids, and some people are needle sensitive. And look, acupuncture is a lot of people are scared of needles, and they're not willing to try acupuncture simply because they're afraid of needles. Yes. This could pose a great solution to that.
Yes, and there's also the next question which arises. When you would, or when, for example, the typical standard methods, or what school medicine educates. So when those patients would not come to see you, and they would be, let's say, treated or non-treated by, let's say, other doctors.
Conventional doctors.
Conventional doctors, right? So what would happen? What is their destiny? So what would happen to those? Would they become blind?
Yeah, that's
and no chance to do anything.
No.
With that, what do you know, the tools, the methods, what other clinics, university clinics, ophthalmology clinics, and specialists have in their hands worldwide?
Yeah.
No other way.
There's nothing. For retinitis pigmentosa, for macular degeneration, there's nutrition. For retinitis pigmentosa, they recommend vitamin A, maybe fish oils can slow the progress in certain cases. There's investigation of other nutritional therapies. They're investigating things like stem cell and gene therapy, but in my opinion, that's a long way off. It's not going to happen anytime soon, and right now people are going blind. So a lot of people don't want to wait for that. So to answer your question right now, that for a lot of these conditions, there is no treatment. There's no drug, there's no surgery that can benefit these conditions, and that's primarily what conventional medicine is. So, the diagnosis is, learn how to read Braille, go home, and it's a blind sentence. You're going to go blind. We don't know how long it's going to take, but get ready for that.
Yeah. But when they see you, they have a chance.
Good chance.
A very good chance. And how can you give now this exciting news, let's say, when somebody, imagine somebody meets me on the street and says, you know what, I'm sick, I have glaucoma or a cataract, or I have a disease which may lead to blindness and I don't know where to go. Doctors say there's no chance, and now I would give him your address. And
Yeah.
so this is fantastic. I mean, I would love to give this address to millions of other patients in the world. What can we do now that this can happen? So
Right.
what would you suggest? What do we need to do?
Well, first there's a couple things we need to do. We need to get viral awareness. There's things like the internet, which is one of the reasons we're doing stuff like this. It's largely word of mouth. You know, there are things like social network groups, there are online groups, there are support groups. So from that aspect, just getting people talking about it is very beneficial. Also making network connections through other holistic oriented practitioners, whether they're doing acupuncture, nutrition, low-level laser treatments, or whatever, to get them talking about it as well, to say, look, you know, this is something I heard about. You know, I think the biggest thing that we really need to do is, you know, start to get larger scale projects going, like start with clinical research, then go into real evidence-based research, which is supported by major medical universities. That's what I see as being the best way to start getting this information out there and making these options available to people.
Another question which comes to my mind is, why does it work, or how does it work? So roughly, when a patient comes, for sure, he wants to know, what are you doing? Dr. Andy, you take a laser, or you take a needle, or in our case, and is that what you said, you support more than needles, of course, to use laser for laser acupuncture. So what happens? And how does it work that you can achieve those results?
Great question. So the first response is we're not really 100% sure of everything that happens when we do these types of procedures. All we can do is measure the response of the body. We don't really know the wisdom of the body and what's happening. But we have been able to measure increased blood flow to the eyes. We have been able to measure increased photoreceptor activity. Photoreceptors are basically your eyes that are perceiving light and picking up light signals. So that's why we lose our vision. So we improve the circulation to the eyes, improve the nerve conduction and the retinal cell activity and the optic nerve activity. We're firing off these electrical impulses and these nerve impulses, and we're measuring that. So it's more of a response. You use a stimulus, either an acupuncture needle, a laser therapy on specific key acupuncture points, and it sends a signal to the brain. And the brain will start to send a signal to the eyes to increase blood flow to the eyes, increase optic nerve activity, retinal neuron activity, and it's a stimulation. So that's as a result of that, people see better.
Correct. So that means that the laser helps in that areas where, for example, the blood flow is not good enough, where you need more oxygen, and where you want to stimulate impulses either via brain to the eye, or let's say to nerves, and so this is what you can say, that this is one or some of the mechanism what is enrolling when you using the laser and treating specific acupuncture points.
Correct. So from the acupuncture points, we're going on the basis of Chinese medicine, that there's energy blockages in the body, excesses or deficiencies, congestions. So what we're doing is opening this. So again, increase the qi or energy to the eye to increase ATP production, also to open up balance the energy imbalances in the body through acupuncture. And again, also more locally, just to stimulate the blood flow to the eye, circulation, ocular detoxification, get rid of things like drusen and ocular waste products.
So do you think that your protocols you are using in your clinics in Watchung and in Westfield, correct?
In Westfield, New Jersey, right.
In Westfield, New Jersey. So that those should also be in hands of other ophthalmologists or acupuncturists in the world, because they could achieve then, when they know how to do it, when they follow exactly your protocols, they would achieve the same results. Is that what?
Well, that's the goal.
That's the goal.
The issue with Chinese medicine is that every patient is treated differently. So in order to get the best results, we need to do a systemic, holistic evaluation of the underlying causes of each condition. So that's going to be, that's one side of the training. But I don't think after the testing that we've done and we've created some protocols, we're still seeing results. You know, I actually wasn't sure when we did this initial study with Johns Hopkins. The challenge was to create one protocol, a one-size-fits-all for everybody. Admittedly, I was a little nervous. I didn't know if this would really work or get the results. But lo and behold, it is seeming to working. Could it get a better result if we have a more advanced or strategic protocol and we do some more research to find out what works better? Of course. But in the meantime, it is showing to work. So it looks like we can develop protocols to help.
Sounds very interesting, Andy. So here for sure is a need of research because it is worth it. We can help, we can say millions of people worldwide who can suffer sooner or later of blindness, correct?
Correct.
Could be helped.
Could be helped.
Could be helped.
Could be helped.
And now, not because their doctor will say, I'm sorry, I did all what I could, and what I do now, and as you said, is perhaps to prolong, let's say to not to stop, but to reduce some effects or to prolong the time until it becomes worse and worse. So nothing really what has to do with curing. There's no chance at all, and not to improve. This is the destiny of millions of people.
Correct.
People who would have had the money to pay for, even when it were the question of those, let's say, in countries where, let's say, the social situation is already one of the reasons that specific diseases can break out and not be cured or treated as in, let's say, first world country when you're allowed to say so. But on the other hand, here is something which is for everybody, even in the United States, not known everywhere, correct? So
Correct.
what can we do now? You talked about a study, a real evidence-based research study to get more protocols, more experiences and methods and values, figures in hand so that you can say, okay, this, and randomizes so that you have a turnkey protocols for a variety of patients, indications, what you can give to, let's say, the world, to other therapists, correct? So for this study, what do you need for this study, Andy?
Well, we need able and willing people who are interested. That's first of all. What we're really looking for is, I'm actually actively going out now and interviewing and meeting with eye doctors and ophthalmologists and optometrists here in New York and New Jersey in the tri-state area, just to try to generate interest, not necessarily in me or to get referrals, although that would be nice, but more to see who would be involved, who would be interested in being involved, or who would know somebody who'd be involved in either collaborating or helping to fund a project like this, or something to help advance this. Because right now there's nothing else going on. You know, you have stem cell and genetic and gene therapy research, but that's years and years off at best. This is something we can do soon. You know, months, a year. You know, we're already doing it. But in terms of increasing at large scale with the right resources, the right people, the right connections, we can really get this out there to the people who need it fast.
Very good. Andy, I hope that we will find a lot of interested people, groups, who may look for us. We will show after this video, of course, how to reach you, how to reach Ernesto. And I can only say it is very exciting to see what is happening here in your clinic and talking to patients and see your results. Look on your website, for example. So I can only wish you good health, of course, so that you can give your experience to many of those suffering patients who can really look into another future and stop suffering because they have a chance to have their vision back and to improve their vision. This is fantastic, because to see how beautiful our world is one of the most important things. So again, Dr. Andy Rosenfarb, thank you very much for this kind interview, for your time, and all the best.
Thank you, sir. Appreciate it. Yeah.
Okay, thank you. Bye-bye.
Thanks, Ernesto.